So I'm going to kick off this morning real briefly. We have a message that the governor sent over yesterday for us since she wasn't able to join us. And I just wanted to read that off, and then I've got a couple introductory remarks before we get into the first part of our programming today. Just a brief few words from the governor. She wanted to thank everyone for being here. Although I'm not able to be here with you, I wanted to acknowledge the great work of the Criminal Justice Commission to bring you all together. A group of individuals from multidisciplinary fields committed to improving public safety, the public safety system, and strengthening overall community safety for Oregonians. Our public safety system faces many challenges that are not isolated or unique to public safety. People who interact with the public safety system face barriers to safe housing, essential services, and the mental health and addiction care that they need. All those needs interact with and impact each other. Our communities are safer when Oregonians have safe housing and access to the health care that they need. I continue to stay focused on homelessness, housing, and improving access to mental health and addiction care. My recommended budget builds on our progress preventing homelessness, sheltering individuals experiencing homelessness, and rehousing people from shelter into permanent housing, and increases access to mental health and addiction care by investing in more treatment capacity as well as initiatives to support the behavioral health workforce, thereby focusing on helping individuals before they come into contact with the public safety system. In addition, my budget continues to support efforts to serve individuals in their communities to reduce recidivism and provide people with the help they need while protecting public safety and holding individuals accountable. This new year carries a lot of change for us all. Let's tackle problems with purpose and embrace opportunities for change together. We must find collaborative and innovative solutions to ensure safety, fairness, and justice. Thank you for everything you do to make Oregon healthier and safer for everyone. So this morning we have two items on our agenda, and we'll be ending after lunch. So in a few minutes, as we wait for some of our legislators to arrive, we will have a meeting of the Joint Committee on Addiction and Community Safety Response. This joint committee brings together members of both the Oregon House of Representatives and Oregon Senate and was created to address the crisis of addiction and substance use within our state. Organized in advance of the 2024 legislative session, the committee crafted House Bill 4002, which, among other things, recriminalized possession of user amounts of drugs, strengthened laws related to drug dealing, made modifications to pre-existing conditional discharge programs to extend its reach, required expungement for low-level misdemeanor possession, created a grant to fund opioid use disorder programming in local jails, and created the Oregon Behavioral Health Deflection Program. Today's hearing will center on the deflection programming and programs across the state. Currently, the CJC funds 27 deflection programs across the state representing 28 counties. These programs are in their infancy, but many are beginning to get their feet under them and showing positive results. What has really hit me during the rollout process for these programs is the enthusiasm I've encountered from our county partners. Many view these programs and the funds provided by the legislature as vital stopgaps that can help local counties reach individuals within their communities who have long struggled with addiction and engagement with the criminal justice system. By bringing together you as practitioners along with the members of the Joint Committee, we hope that the committee will see that excitement and dedication. I also hope that the programming we are presenting this morning will bring additional valuable information to the Joint Committee as it considers possible changes to House Bill 4002 in the current long session. In hopes of accomplishing this, the hearing will include 5 panels this morning, or 5 presentations or panels. We will begin with a deflection best practices report overview by Dr. Elizabeth Waddell. You'll then have to listen to me talk about a little bit of a data update on statewide recriminalization and deflection stats. We then will have Dr. Chris Campbell, who we heard from briefly yesterday, talk about deflection referral pathways. And then we will end with 2 panels of folks. First, we will have our sheriffs and a program manager from Wasco and Hood River counties talk about regional partnerships, both the benefits and challenges of working together on deflection programs. And then we will have an amazing panel of folks who will talk about the experiences of individuals within deflection programs. Some of the folks are actually on the ground providing services. And so at this point, as I look over, I would like to turn the microphone over to the co-chairs of the committee, to Senator Floyd Przonski and Representative Jason Krupp, so that they can say a few words, and then they can gavel us in if you are all ready, or if we're waiting on a few more people, we could take a break for just a minute or so to let a few members get in.
Good morning.
Thank you.
Everyone. I'm Floyd Brzezinski, State Senator, Senate District 4. Senate District 4 includes half of Eugene, all of Springfield, and little rural areas south of the two cities. I want to thank everyone for being here today and yesterday. I understand the conference went well. Today, as you've heard from Ken, what we're wanting to do is get information out to everyone that's participating as to how the deflection programs are working and looking at ways that we can continue to improve and incorporate more of the communities around the state that are in the process of bringing in deflection programs. I do want to note that, as you can see, there are a couple of vacant seats up here. We have committees that are meeting today in the Ways and Means process, and so we hope that other members will be able to break away and join us. We had a couple that will not be able to join us today just because of their conflicts with their committee work and with Ways and Means. And because the Ways and Means is the money side, they felt that they should be there versus with us today. So I hope you'll bear with us as we go through this process, but thank you again.
Good morning. I'm Jason Krupp, State Representative from House District 54 in Bend. Thank you for having us, Ken, and thanks for putting this together. And I just appreciate everybody being here for the summit yesterday and today. I'm excited about these conversations today, and I've been excited about sort of watching innovative practices happening throughout the state. I think this could be a big part of what our public safety system looks like. I know we all have folks that are in crisis in our communities, and the ability to connect folks with the services and support they need sort of earlier in the process, I think can have a significant impact on the goals that we're all trying to accomplish. So I look forward to this conversation today. This is really bright all of a sudden.
Yeah, we should have brought our sunglasses. So at this point, I guess without having a gavel, we're gaveling in, having an informational hearing. And we have invited speakers, as Ken has stated. And the first that we will be doing is the deflection best practices and standards report preview. And we have Elizabeth Needham Waddle will be presenting this. And I'm not sure what the format will be, if she's coming up in front or how this is going to set. Here she comes.
Co-Chair Brzezinski, Coach Krasonsky, Co-Chair Krupp, members of the committee. I am Dr. Elizabeth Waddell. My team at the OHSU PSU School of Public Health is contracted by the Oregon Criminal Justice Commission to develop the Oregon Behavioral Health Deflection Best Practices Report, as well as to develop and maintain the statewide behavioral health deflection data tracking system. So today, I'm going to give you a preview of findings from the report, which will be published on April 1st. So there are a lot of definitions of deflection, and deflection is operationalized differently across different localities. This nationally recognized definition uses community very broadly, including partnerships between law enforcement and a wide range of service delivery organizations. So I'd like to read the definition. Collaborative intervention connecting public safety and public health systems to create community-based pathways to treatment for people who have substance use disorders, mental health disorders, or both, and who often have other service needs without entry into the justice system. We want to acknowledge that deflection participants in Oregon and nationally are not always enrolled in deflection prior to any engagement with the criminal justice system. So the best practices report is comprehensive, it's long, it includes national best practices and information about the Oregon experience so far. So our sources include a literature review, consultation with national experts, interviews with Oregon grantees, review of the BHD grant applications, grantee reporting to the Criminal Justice Commission, as well as statewide program data collected in our web-based tracking system. My focus today is best practices for program elements that have been observed nationally. In Oregon, as you know, we are in early days and we're still learning what works locally. So here are some findings from the national literature, which we explore in more detail in the best practices report. Program coordination. So at the national level, there's a lot of descriptive data for programs that have been conducted across the country. We don't yet have a strong evidence base that compares effectiveness of coordinating agencies. We do know that most programs are led by law enforcement and housed in law enforcement agencies. We know that program coordinators operate at different levels across programs. Some coordinators operate at a high level within the program. They may oversee program staff, manage operational issues, work on building interagency partnerships, while some coordinators are more involved with the day-to-day operations, working directly with program participants on tasks such as program navigation, referrals to services, as well as data collection and participant tracking. Coordination and communication with interagency partners and intra-agency staff is critical to the successful operation of deflection programs. And we want to make sure thoughtful consideration is paid to where the program is housed primarily and what the job description and role of the coordinator is. Eligibility. So we know that possession of a controlled substance for personal use often occurs in combination with another crime. Using standalone PCS, PCSU for eligibility limits the number of people, obviously, entering the program. The recommendation is to broaden eligibility beyond standalone misdemeanor PCS to extend the reach of deflection programs. So these are a couple of strategies for scaling up for localities that are ready to scale up. Allow other low-level, for example, quality of life crimes. And write rules that are deliberately flexible that will enable case-by-case considerations for eligibility. Deflection pathways. Dr. Campbell is going to go into much more detail on the deflection pathways, but I want to provide a high-level overview, again, for orientation. We have self-referral, and that is when an individual voluntarily initiates contact with a program. Active outreach, where law enforcement or partnering community organizations perform direct outreach to potential deflection participants. The naloxone plus pathway is usually conducted in the context of an overdose response. The officer prevention pathway specifically is when law enforcement initiates a referral to deflection and criminal charges and no criminal charges are present. Officer intervention is when law enforcement initiates a referral and criminal charges or potential criminal charges, which may be held in advance, are present. The community referral Those are community-based referrals, typically done by health teams or peers in the context of de-escalating a crisis, and those also include direct referrals to services. Pathway selection for a local deflection program really depends on the needs, the resources, and priorities of the local community. We don't know nationally yet which pathways are the most effective, but we do know that the data show that best practice is to operate multiple pathways to deflection. First point of contact. First point of contact is determined in most part by the pathway to deflection that's selected by local programs. Most across the country will involve law enforcement. The literature also shows that we want to encourage self-referrals and social referrals, particularly with no charges present. Again, that's to reach a broader eligible population to participate in deflection programs. So what's co-response? Co-response is when law enforcement works directly in partnership with behavioral health, and especially with peer support specialists. The literature shows us that co-response facilitates program participation. It also facilitates connections to resources and reduced recidivism. Handoffs to programs. So what is a warm handoff? We're always hearing a lot about warm handoffs. It's a process where law enforcement or other first responders, maybe it's fire, EMT, mobile crisis, actively connect individuals to services or program staff in person at the time of referral. We know that warm handoffs are the best strategy for engagement in deflection and retention in deflection. So some examples are law enforcement handing off to a peer, law enforcement transporting to a deflection drop-off center, or a mobile crisis team connecting directly to deflection program staff. Co-response facilitates warm handoffs, and programs with highest levels of warm handoff capacity have shown the highest rates of converting referrals to program enrollment. If a warm handoff is not immediately available, outreach as close to the time of the deflection referral is ideal. What's success? This is another really tricky question. Individual success might be defined as completing the program, but there really is no standardized definition of success nationally. A challenge with comparison of deflection approaches across counties or across states is that the endpoints can vary so much. There's no apples to apples comparison currently in the national literature. So here are two general ways that individual success has been described: high-level case-by-case or predetermined metrics. In case-by-case approaches to defining individual success, that success is determined based on individual assessment, typically by program staff. So there are a number of factors that may be considered in a case-by-case approach, such as reduced substance use, improved housing, employment, engagement with treatment, improved self-sufficiency or functional status. Approaches using predetermined metrics might include completion of a behavioral health assessment, attending treatment for a specified amount of time or number of sessions, negative UAs are also used. So in Oregon, there's really massive variation in program goals, as we know, across counties and geographic settings, model designs. Through our statewide data tracking system, which Director Sanchakran will talk about a little bit, we have a unique opportunity in our state to examine program elements using standardized metrics across localities. So this is going to enable us to conduct a more direct comparison of programs, to inform and continue to understand what statewide best practices are appropriate in a wide range of settings. So as I mentioned earlier, this presentation is a brief preview of the report that will be published on April 1st. I'd like to thank Co-Chair Przanski and Co-Chair Kruff, members of the committee, for this opportunity to share our work, and I'm happy to take any questions at this time.
All right, thank you. My understanding is the way the format is that people are texting questions in. At least that's what I understand. I'm not the technical person, so Ken and his staff, is there any other guidance? Let me first ask this for members. Are there any questions that you would like to present? All right, we're on pause just for a moment as Ken comes over and tells us the certified answer here. Sure.
Carol?
We got the time, we can just do it. Okay, why don't you go ahead?
I have a quick question, Doctor. I have a question over here.
I can't see because of the
Oh,
light.
right.
We're over here on your left.
Yeah, you talked a little bit about the warm handoff, which makes a ton of sense to me. I imagine that is easier in a sort of denser, more urban setting and more challenging in sort of a rural setting, a larger
Absolutely.
geographic area. Do you have thoughts about kind of adhering to that warm handoff best practice, but in a sort of larger, more spread out region?
Yes, I have many thoughts. Thank
Okay.
you for the question. Clearly, if there are services a mile away, it's going to be much easier to provide a warm handoff to services that are 20 miles away. And as I said earlier, a lot of the program models and practices will depend on geography and other kinds of resources in the community. When a direct handoff to services in the moment is not available, the ideal is to organize a handoff that is in person as soon as possible with the deflection candidate. So this might happen through a peer, for example.
Thank you.
And I believe there is an audience question, so if they would like to present.
So the first one says, how come, it's kind of a long one, how come there are so many competing programs, deflection, treatment courts, 416, but no organization or screening that feeds all of the systems? Why aren't risk levels determined at arrest and then cases or people fed into an organized system based on risk and need? I can read the rest of it, but it's a little bit extrapolating on that. Do you want that additional information?
Sure.
So then it says, so much funding is used for all programs that are essentially competing to serve the same populations instead of using validated screening tools to have multiple tracks, which would be more fiscally responsible for Oregon taxpayers. The current system allows gatekeeping by lawyers or system partners that create equity of access issues and open the door to bias.
Thank you for that question. I am not prepared to respond to all of those issues through the work that we've done with the best practice report. What I can share is that deflection grantees are encouraged, and most do provide referrals for screenings. Many of the screening tools that are being used now in Oregon counties are in fact evidence-based, and we are going to be looking in the future at those paths and how they might vary based on the screenings that are used and the referrals to services that are encouraged by those screenings. So I'd like to stop here, and I can I can connect with the Criminal Justice Commission and get more information about the funding behind the bill.
Wonderful, and we encourage all of our participants to come and interact with our speakers so they can get more details as well. The next one says, where might you see restorative dialogue service fitting into the deflection programs? The definition of restorative dialogue is individuals engage in dialogue to repair the harm to impacted parties and community.
Thank you for that question. Again, the precise content of a deflection program that's operated in a locality is going to be different. We do know from our review of national programs that restorative justice, reparations, for example, have been included in deflection plans.
Representative Mannix had a question or comment. Do I need to hit the button?
No.
Nope, you're good.
In response to the first question, I think we all need to understand that we're engaged in a brand new dynamic statewide with 36 counties involved and potentially 36 different approaches. Actually, there's probably a dozen different approaches occurring, but this is because we tried to open the door to a variety of approaches based on what works best in each community, and then we have an opportunity to evaluate how those approaches work, rather than starting out with a didactic program where the state says you must do this way, and then we find out, of course, that it doesn't work in certain localities. Instead, we're saying you may take a variety of approaches. Let's see how it works for your community. And hearing about the gatekeeping by lawyers, let's get back to the fact that we're talking about what is now deemed to be a type of criminal conduct, and we're talking about district attorneys who have to be engaged to see whether or not someone's going to be prosecuted, preferably to be treated and held accountable rather than run through the typical prosecution system. And we have other attorneys, the public defenders, who are going to be out there to watch this system, and ultimately we have judges who are also attorneys to watch this. And what I'm saying is we're talking about a legal process dealing with something which is now technically illegal, an unclassified misdemeanor, but we're trying to bring in those who know about treatment and mediation and assistance and blend them into the program with deflection programs. So it's going to take some time to see what works, and we can learn from one another with those various approaches. So I am not critical to the variety of approaches being taken. I want us to be able to watch how they work.
Thank you very much.
You'll get it? Yay. How is self-referral considered part of deflection when there are no legal charges versus someone entering medical treatment? And why would mobile crisis refer to deflection versus treatment?
So that's another really great question. And again, localities have a lot of latitude in choosing deflection pathways. So I'll share again, these are the 6 most frequently used deflection pathways nationally. Deflection typically refers folks to a program prior to arrest, prior to involvement in the criminal justice system. Not always, but most of the time. Referrals to deflection may be directly from a community agency. Self-referrals are possible as well. As far as the logistics of selecting participants and establishing eligibility of deflection candidates, those decisions are left to the localities, and they are not predefined by House Bill 4002. Yes.
There you go. How can we define best practices when no one has defined success?
Well, that's exactly what we're trying to do now. We are doing our best to really understand exactly how programs are bringing folks into deflection, what happens during deflection participation, and what are a long list of outcomes individually. We're also collecting participant identifiers, which are able to be connected to state administrative data so that we can look at changes on individual level and potentially county level. And this part of the research with the administrative data is being led by the research team at the Oregon Criminal Justice Commission.
I just want to comment a little bit about that first question about assessing risk level. I think that was actually a pretty apt thing for us to contemplate. I spent a decent chunk of, for people who don't know, I was a public defender and also a district attorney for a number of years, and I spent a long time in our juvenile justice system, and we assessed risk sort of predisposition. And then in the adult system, traditionally we assess risk sort of post-sentencing, right? If you get sentenced to a period of probation, then the probation department determines what risk level you are and what level of supervision, or same thing if you're given an incarceration sentence. And I do want to agree with Representative Mannix on this point that we endeavored to allow local communities to tailor programs to their local resources and the local issues that they were seeing, with this understanding that we were going to learn from those programs and learn from national programs to figure out what best practices were going to be to help have some standards in place, and just to learn what's working in, say, my community, or what's not working in my community, and learn lessons from other parts of the state as well. But I do think that is a very appropriate question about when should we be assessing risk when people have contact with the criminal justice system, and then what do we do with that information?
Thank you, Co-Chair Croft.
Yep.
So Dr. Needham. I just want to say thank you to Dr. Needham Waddall for your presentation. We're going to conclude this portion of the informational hearing. We're going to shift to the statewide deflection program stats and data update that Ken is going to be providing to us. Thank you again.
Thanks again to the committee.
Okay. Yep. Okay. Co-chairs Przansky and Krupp, members of the committee, Ken Sanchgren for the record. I appreciate you all being here today, and I'm going to briefly run through. This is a presentation that should seem very familiar to you. It's like what we've presented to you all at different legislative day updates, but since I've not updated the committee since December on deflection outcomes and other data points, that's what we're going to focus on real briefly here this morning.
Ken, if you'd like to take the podium and move it more toward the to the audience, I think that would be more appropriate.
Okay.
Instead of speaking
little awkward compared to normal, yes. So at the commission, we, since the initiation of deflection and since the initiation of the law changes in 4002, have been tracking data on our dashboards. And so what you'll be seeing here today is primarily data that we've drawn from our dashboards. And so you can go and look at any of these figures that I'm showing on the screen. We update them weekly, usually around Wednesdays. And so you can keep an eye on what's going on deflection statewide. So I'm going to cover all of the criminal justice system measures that we have, in addition to a little bit more of a deeper dive into deflection data during my presentation here over the next few minutes. So we're going to start at the beginning of the criminal justice process. We're going to look at PCS arrests that have occurred since the recriminalization of small amounts of drugs occurred on September 1st of this past year. I do want to note that when we're talking about arrest data, we at the Commission are unable to separate out arrests for the new drug enforcement misdemeanor versus the old A misdemeanor or felony PCS arrests at that point. And so this is the entire universe of arrests that we're seeing post recriminalization. So between the 1st of September, when recriminalization occurred, and the 5th of this month, we've seen just over 5,000 arrests statewide that have been logged into LEDs. Again, this is for all types of possession. Pre-COVID, we averaged around 300 arrests per week. Since recriminalization, the peak weekly numbers we've seen is at about 218. So we're not quite pre-COVID levels. We're at about the beginning of COVID levels here as far as PCS arrests are concerned. Around a quarter of all of those arrests are for standalone PCS, which means that they do not accompany any other charges at all. And the most common co-occurring crimes that we see, some of which were kind of mentioned by Dr. Waddell in her presentation, might be thought of as more commonly public order crimes, trespass, failure to appear, theft in the second degree, and probation violations. And so we also have on our website, so for each of these different criminal justice system measures, we have just counts by county, so we can show where this action is occurring across the state. The most active county from the beginning of this process has been Jackson County. They've seen the most arrests primarily in the Medford area, although we've also seen a high volume in the metro, like we would expect as we just do this breakdown across different jurisdictions. So the circuit court trends is what we'll talk about next. The line graph that we present here looks similar to what we had for arrests, but we are talking about a different universe of cases now. Once you get to the circuit court level, we can separate out the drug enforcement misdemeanors from A misdemeanors and felonies. And so what I'm displaying here is simply the drug enforcement misdemeanor cases that are being filed post the implementation of 4002. The comparison line that we have during between ballot measure 110 and the implementation of 4002, those are the e-violation tickets. We're trying to find something that is at least somewhat comparable over time so we can look at volume changes. Between the 1st of this year and the 1st of this month, or excuse me, between the 1st of September and the 1st of this month, we've seen around 3,100 drug enforcement misdemeanor cases. And so we went from those 5,000 overall PCS arrests to around 3,000 drug enforcement misdemeanors. Because these are just the drug enforcement misdemeanors, we do have a slightly higher share that are standalone DEM cases. It's about 53% currently. And so that is something that also looks very different compared to what we see at the arrest level. However, the most common co-occurring charges are similar to what we see with arrests. Again, we have those trespass twos, theft twos, and those types of crimes are the most common ones that we see when circuit court cases are filed. Now we'll move on to deflection. So the deflection numbers that we have are being tracked by our partners at OHSU, headed by Dr. Waddell, who we heard from just a moment ago. We utilize the REDCap data reporting system, which creates an individual record for each deflection referral that then is reported at least monthly back to the Criminal Justice Commission. And so what we're relying on here is what the counties have reported up. I do want to mention, however, that while grantees are expected to report monthly, it is still a new program, so sometimes there's a lag, and even when we say monthly, we don't mandate that anybody reports on the same date, and so we might have a little bit of one program might put in a batch, and the other one might do it maybe a week after we look at the data. So we're still early in this process, is just the note that I'm making here. So far, what we've had across all our deflection programs to date is 894, so almost 900 referrals made statewide for 841 people. We do have some folks who have had multiple referrals, as we'll see on the slide here, but overall, as far as volume is concerned, we're getting close to that 1,000 referrals, although you can see that once we move from referral into actual program enrollment, we do see some drop-offs there as you move through this diagram. So we also have a quick map of where the deflection referrals are happening, we see some of our highest volume in Multnomah County, Yamhill County as far as referrals are concerned, and then other counties are beginning to catch up. Some have just started. We see that some actually don't have any referrals yet. Most of those are much smaller counties or who have not really ramped up their programs yet, and may be still in the planning stage. So the majority of referrals, as Dr. Waddell mentioned, come via law enforcement. I think that's by design, at least how the county programs are set up at the moment as law enforcement referral programs. We do see a small number of referrals coming from other referral sources, like Dr. Campbell will talk about in a few minutes. And I think that, as it was even touched on by the question that we had earlier, there is some worry about how programs could incorporate other types of referral sources, and that's something we're hearing from our grantees. We heard it from the audience today, and so that's something that certainly we need to look into moving forward, given that what we've just heard in the best practice report, that these multiple referral approaches are what we should be aiming towards in the future. We also have data on the folks who are not completing deflection. If we went back to the Sankey diagram a few slides before, we saw that we had a number of folks who, as they come into the deflection program, they have in most cases relatively quickly, through non-engagement, they have not succeeded in that program. And so we have the different reasons here. There are more options in the REDCap data system, but we don't have a lot of data points in those other options, so we put up the most common ones here. Most program failures, as I mentioned, really seem to happen when folks are not able to, or just decide not to engage immediately after referral. And so there are folks who either are lost and unable to contact after that initial deflection encounter, they don't engage with their treatment plan, or they voluntarily leave the program. I think importantly, most folks are not being disqualified for additional criminal involvement after the the deflection referral. It's mostly a non-engagement issue at this point. Oops. As far as referrals into services, we see that many individuals, they actually engage in services that cut across different domains. And so in many cases, they may actually be referred into multiple buckets here that we see on the screen. But for the most part, social services, SUD services, I think unsurprisingly, are the services that we see folks being referred into. As we move forward, we do collect much more detailed information as to the type of service folks are referred into. As we continue to get more numbers, then we'll provide more detailed breakdowns on our website. So then just a couple other takeaways from different data draws that we've had over time, thinking about who are the folks that we are helping through the deflection process. We know that many of the folks who we are encountering in deflection thus far have pretty significant needs. Many, or if not, a majority or a slim majority are, they don't have stable housing at the baseline moment of referral. Most folks are unemployed, and around a third require even basic food assistance. And so we have a breakdown of their shelter situation here on the screen as well. We also know that of folks who were given an assessment, almost 90% identified as substance use disorder, or were identified as having a substance use disorder, and a little bit over a quarter were identified as having a mental health disorder. So what I'll end with is the final stage in the justice system, moving away from deflection for a moment. We've just begun to, and for the first time, put on our website numbers for conditional discharges as well. Clearly the system needs to move a little bit before you can get to the conditional discharge level, and so we waited until around the 1st of this year to put this on our website as well. But what we see is that between the 1st of September, when recriminalization occurred, and the 12th of February, around 275 folks have been admitted to supervision in DOC for drug enforcement misdemeanor charges. 73% of those have been in the conditional discharge. Around a quarter of them have gone into probation as normal, or kind of more traditional probation approaches. And so that's the data update that I have. I'd be happy to take any questions, and if we don't have a lot of questions from the committee, then we'll take maybe one or two from the audience.
Any questions? We're good on this side.
Great. Carol, did we have, maybe we can take two to keep us on time?
So this one says, are the impacts of recriminalization being studied or tracked independently from results of the deflection programs?
And could you read?
Absolutely. Are the impacts of recriminalization being studied or tracked independently from results of the deflection programs?
Yeah, thank you for that question. Certainly, we are, I think that some of the impacts that we're looking at are exactly what we've been talking about today. And so we do think of this as kind of a holistic program. We know that, whether it's some programs are initiating an arrest before a deflection occurs, some are not. And so we think that all of these different data points, they do stream together and they roll together to a certain extent. We do have separate statutory mandates to look at racial disparities as we go through the as far as criminal justice system outcomes are concerned, and even outcomes for changes to drug dealing that were made in 4002. And so while I think the answer to the question is yes, we're separating them we're studying them separately, it's also really hard to disentangle how all of this is now supposed to work together. And so I guess the answer is a little bit of both. That's all. Okay. And so that concludes my testimony.
Ken, thank you very much.
Thank you so
Our
much.
next presentation is going to be on deflection referral pathways. We have Dr. Christopher Campbell.
Right. Good morning, everyone. Co-Chair Prozonsky and Co-Chair Kropf, as well as the committee, thank you all for giving me the opportunity to speak to you all today. My name is Dr. Christopher Campbell. I am an Associate Professor of Criminology and Criminal Justice at Portland State University, and I'm also the Director of the Criminal Justice Policy Research Institute there at PSU. And I'm also serving as a subject matter expert for the technical assistance that's operated, deflection technical assistance that's operated through the OHSU and led by Dr. Dan Hoover. So today I'm going to be talking about some of the ways to potentially expand participation in what we currently have going on with deflection, but then also talk about what it means to potentially expand our different pathways. And I'm trying to piggyback off of a lot of the great work that was just talked about by Dr. Waddell, as well as Dr. Sanchigan. So to give a quick roadmap, I'm going to start by summarizing some of the deflection efforts, highlighting some of these, a few of the statistics that Ken just talked about, but then switching back to what this means for participation and expanding participation. Then I'll discuss some of the barriers that limit that participation, including officer buy-in and eligibility constraints. And then from there, we'll talk about what other pathways we could expand to, the challenges of those, and then what we have offering right now in terms of technical assistance. So Dr. Waddell and Dr. Sanchikran already talked about what's going on in the state largely. Again, 27 different jurisdictions using or one is planning deflection currently. All of them are involving two primary pathways, and really it's just one is the real focus. 18 of them have multiple different referral efforts, sometimes with a few other pathways sprinkled in here and there. The primary one is the officer intervention pathway. It's that that's the overwhelming majority of them, where we're holding a charge in abeyance over a defendant's head or someone who is potentially deflectable. The officer referral or prevention pathway is distinctly different in that there is no arrest option there. The idea is that you're actually the officer's coming across someone in their routine activities, and then you just offer them deflection. You seem like you're having a hard time. We would like to get you services. We have services available. Would you like to partake in them? It's really developing a lot of rapport with the officers and the public in that way. So across the 27 jurisdictions, there have been roughly 900 referrals, as Ken was just talking about, in 7 months since September. There have been 707 deflections among the 11 programs that began in September of 2024, which aligns with the CJC dashboard reporting on PCS arrests. These 11 deflection efforts have deflected about half of the 1,300 possible deflection events, which is crudely operationalized here as PCS-only arrests plus the referrals themselves. This isn't a perfect estimate, right? As some of the DA, there are a few jurisdictions that use DA diversion efforts, which I'll highlight. I'll show you where those kind of fall in this whole discussion in a moment. But it doesn't really capture when somebody gets arrested and then deflected after that, right? So again, it's a crude estimate, but it kind of gives us an idea as the potential leftover cases. So this kind of suggests that there is likely around 600 cases that were not deflected but could have been. This number highlights what I immediately think of is the potential officer buy-in issue, where we have had counties directly ask line officers what the barriers are, and several of these officers have indicated, it's like, well, I don't really believe in this. I don't think it's actually going to work. I don't know the process. So a lot of it is really legitimacy-based from the officer's perspective, which is pretty critical. I should note, though, that there are a lot of line officers who really do buy into this. They're very, very much on board with deflection. We've seen and heard from a number of them. But it's worth noting that there are still several out there in a meaningful circumstance, particularly in rural counties, who will say, I don't necessarily believe in this. So some work to be done there still. Sticking with the 11 programs that began in September, again, of 2024, we see that these 11 efforts have deflected about a quarter of the nearly 2,800 possible expanded deflection events, which again is crudely estimated here or operationalized as PCS arrests and co-charge arrests plus the referrals, the events themselves. So if we were to expand the eligibility to include individuals charged with the top 4 co-charges, which Ken was just highlighting in his presentation. So that's failure to appear, theft 2, trespassing 2, and then supervision violations. If we were to expand to those, we have an estimate of about 1,400 who were not deflected but could have been deflected. This is what I highlight as the eligibility issue, right? So a lot of jurisdictions are kind of hung up right now on whether or not we should really incorporate more charges, especially on the DA's level. They have a concern that some of these involve a victim. When you have criminal trespass, or if you have a theft, there is a potential victim involved. What we're kind of suggesting here is that those should be open to the option of approaching the victim if it's a business, for instance, and talking to that business and saying, we think that this defendant has an issue that we can address in another way so that this doesn't happen anymore. We could prosecute this person, but we could also address their issues, right? So we have a process to do that now. It's called deflection. Would you like to participate in that? What can we do to help? So about the 6 pathways that Dr. Waddell already efficiently went over. I'm not going to spend a ton of time on them, but I do want to highlight a couple of things. And one in particular is that there was a national study done by the BJA and the CHJ. There are national experts on deflection. And they highlighted that there are not just these 6 pathways, but of 321 organizations who they surveyed, only about 32%, so the least amount of, or the lowest proportion of organizations actually engaged in the officer intervention pathway that Oregon primarily focuses on. So it's one of those things that a lot of jurisdictions went a different direction with. And it's worth noting because what they tend to do is take a lot of these other ones, in addition to the officer intervention one, but they'll layer them. They will make them multiple levers that they can pull to try to deflect someone and keep them out of the system and address their needs, essentially criminogenic needs. So these are otherwise, we have to think about this as the self-referral thing. We have to think about this population as folks who would otherwise be in your jails or going through your court system or taking up time from patrol officers, calls for service, et cetera. But if we approach them and give them a self-referral pathway, if we give them another deflection effort that doesn't involve that limited resource, then we're minimizing the amount of time that we're dealing with them later. So aside from that, I want to highlight one of the most prevalent among these 321 organizations across the nation was the Naloxone Plus. And Naloxone Plus is specifically an outreach effort for folks who have just gone through an overdose. So that first 48 hours after an overdose, someone is most susceptible, or receptive, I should say, of potential deflection efforts or treatment, right? So this is that key window when you can approach someone and say, you've just had a near-death experience. Can we help you? We've got services available for this. Would you like to talk to us? So when thinking about all these pathways, really, all the deflection pathways, is that they occur prior to the invoking of the system, right? That invoking of the system is just before actually filing charges, ideally. Or if you're holding a citation, then you're not moving on that necessarily, right? Any district attorney diversion efforts is actually invoking the system. It is a diversion tactic, right? Or a treatment court. These are different. These are procedurally different. The two highlighted there, again, are the ones that we primarily focus on in Oregon. So I wanted to provide a quick example of what this could look like in one of our counties. I chose Multnomah County. I had the data quickly available, so I went ahead and went with it. And from this, I put together a graph that was created using LEDS data. The CJC folks provided a great overview of a lot of the data that's available through the CJC. But this includes the law enforcement database system, LEDS, the Oregon Health Authority, and then, well, that's not the CJC, but the Oregon Health Authority is in this as well. And then the Oregon Judicial Department data is also in this as charges filed. So it essentially shows that monthly counts, this graph here shows the monthly counts of 5 different metrics that we try to use when thinking about drug use. And what we use, my colleagues and I used in our study of Measure 110 that the report will recently be made public. So to take away from this is that candidates, some of the best candidates for self-referral or Naloxone Plus are those who recently interacted with the healthcare system due to drug-related issues. So that highlighted here are the hospitalizations and emergency room visits specifically related to drug issues and coming from the Oregon Health Authority. This is specific to Multnomah County in these given months. So imagine that we engage these folks in a Naloxone Plus scheme, and the idea here is we're trying to bring them into our deflection networks that are already created for this, in the anticipation that they're going to be potentially coming across officers later. If we just basically successfully pull in 10%, we're pulling in, according to this graph, roughly 60, at least 60 people a month into the deflection efforts. So that's substantially increasing participation in the efforts that you all are creating as foundations, right? So that's just self-referral or Naloxone Plus. This might require coordinating with local hospitals, right? And having the local hospitals become a bit of a spearhead in a little bit of the discussion there. Focusing on other pathways, and this is in addition to what we already have, which is the officer intervention and some officer referrals, are the pathways of active outreach, where you have a team or a co-responder model, where you have a team of folks who are actively going out and finding folks who either often come in contact with the system, but they aren't currently, or maybe houseless individuals who they know who are struggling with substance use disorder. To give you an idea of what that capacity might look like, we can look at Measure 110 data most recently, and then before the pandemic, you can look at the defelonization era. What were the PCS charges looking like during that frame? Those are probably the folks that you're going to come across, especially if they had multiple during that time frame. So to begin the wrap up here, challenges for expansion of not just our current pathways, but the other types of pathways I mentioned. Some of them I want to highlight are logistics and funding, right? So if you want a self-referral process or anywhere in which someone can be dropped off or can drop in to connect with your treatment services, you have to have a staff site. That site has to be there. There has to be someone physically there to receive people, right? A lot of rural places, this isn't always feasible, which kind of ties into the transportation issue with a lot of rural places. If you have one, then it could help a lot. And then you also have the transportation. That could help a lot. So I know some rural counties are talking about maybe we could use some of the funds to, if the funds were available, to hire just a transport person, for the healthcare purposes. So they're going to go out and meet officers or meet folks and then bring them to this particular site, and that's their sole job. I will note that there was a program, a deflection program studied in Illinois, in rural counties specifically, that were not really all that close to the specific drop-off or drop-in location, and they were able to secure some type of transportation. They incorporated over 80 referrals and self-referrals in particular in a year. So just imagine what you've been able to do in 7 months for those rural counties that have been working since September, and then think about if you could have had 6 more per month, essentially, or 7 more per month. That could be really beneficial and really kind of utilize all the resources you're putting together. The officer role I want to highlight specifically is that we have these intervention models. They shouldn't be abandoned by any means. They should be strengthened and supplemented, right? Supplemented by other pathways. And not only that, if you're going to address the officer buy-in problem, the officer buy-in issue in a lot of jurisdictions, then you need to have open communication. There were some folks yesterday who were talking about going to the briefings. I've been talking about this a lot. I often say roll call, but briefings are it. That's the time. Go and meet them at that time if you're a deflection or a specialist, and you get to talk with them, have FaceTime with them. It means a lot, right? Not only that, but the follow-up is critical. So that's the active communication and interaction. And then lastly there is identifying goals. A lot of folks, I think a lot of jurisdictions are thinking, we're just going to do this because House Bill 4002 is there, and we do it now. I don't think there was a lot of discussion of like, what are the goals of our county or jurisdiction? If we have a serious overdose problem, you should really think about naloxone plus, adding it to your repertoire. It's just another tool in your tool belt to really expand this. If you have a serious houselessness issue, then active outreach is your thing. You get to know them really well. And it can be in conjunction with officers if it's a co-responder model, but it doesn't have to be, right? You can all be working towards the same goal. So the last things that I'll mention is that we do have this technical assistance going on. It is going on, currently funded through May of this year. There's a number of things that we've been doing for this. For example, some of the activities include coaching discussions. We have regular meetings with several of the technical the folks who are engaged in technical assistance or counties engaged in technical assistance, trying to give them best practices, talking about best practices a bunch. We're also helping them operationalize what does it mean for success. We're helping them think through a lot of these things. And then also highlighting not necessarily training, I don't want to call it training, but it's more like lessons learned. What are other counties doing? What are they learning? And we're trying to bring it to then other counties. So we'll have these webinars that we'll often record called echoes. And then we try to make those available as much as possible. While we've had some attrition since July, so we started about 25 counties working with the technical assistance. Today, we're working with 15, one-on-one, but there's still 20 that's observing a lot of our echoes that we record and then make available. So our counties are still engaging in the technical assistance. It's gaining a fair amount of attention, but I think it could probably be utilized a little bit more. So in closing, as deflection efforts ramp up in Oregon, its impact is currently limited by narrow eligibility criteria and the over-reliance on officer discretion, but it's really looking promising, as Dr. Waddell kind of highlighted, and as did Ken. Things are looking very strong. And by expanding eligibility and incorporating new pathways, we have the potential to really capitalize on this infrastructure that you all are putting together. With that, I'll turn it over to questions.
Any questions? We have a question from Representative Mannix.
Thank you. Listening to your presentation, it occurred to me that the officer buy-in issue may involve two components. One is training and experience with the system, so there's a comfort level. The second is staffing. We have rural counties that have a large size and a low population, which means there's a real challenge to engage pre-intervention. So I wonder, over time, it looks to me like we need to be considering those factors as we develop these programs. Am I reading that right?
No, I appreciate that question. You're absolutely right with that. And I do want to highlight a couple of things. First is with relation to the trainings and that being officer buy-in and how to engage with the system. I think a lot of that is running into just a cohort effect right now of a lot of officers who started the force right after or around 2020, and they didn't really get a lot of search and seizure training or a lot of focus on drugs, really, because of Measure 110. And so what they've got maybe a little bit of hesitance that we've heard from leadership and from line officers who they're kind of suggesting, I don't really know how to engage with this in the first place. And then secondly, what does it mean for deflection to work into that? So it is a moving piece there, and that requires the open dialogue. The other aspect, help me, was
Staffing
the
levels.
staffing. Thank you. So yes, this has to do with how much time you have to spend towards this, right? When we hear officers say, I don't have time for this, it's not worth my time. That's essentially saying, I have other things to do. I have multiple calls for service. I am stretched in multiple different directions. And I think that the staffing is definitely something that needs to ramp up ultimately. Obviously, we all want more staffing. But if we think about deflection as a way that can actually free up your time next month because you don't have to deal with this person as much, I think that's kind of critical, right? So what we're asking is officers do this little extra, a bit of extra legwork, and ideally that warm handoff doesn't involve much paperwork. But in that way, you're saying, I'm passing this person off to somebody, the service provider, and ideally, I'm not going to have to deal with this person next month or in a few weeks. And so that's going to free up some more time for me to deal with other folks in a kind of a similar manner.
Thank you.
Yes.
I don't know. I'm not sure if we have any audience questions or not. We're good? Dr. Campbell, thank you very much for your presentation.
Thank you.
So our next presentation is going to be on the regional partnership, benefits and challenges. We have Sheriff English, Sheriff Miguel, as well as Commander Hepner that will be presenting.
Well, thank you for having all of us today. We appreciate it. Members of the committee, we appreciate that as well. It's great to see some of you. My name is Lane Miguel. I'm the current Wasco County Sheriff, which is up in the Dalles, Oregon. We're going to give just kind of a three-part conversation here about regionalization, collaboration, and what that means for not only rural counties, but our larger counties and our partners like in Multnomah County, Clackamas, and Marion County. So what I wanted to kind of start with a little bit was how regionalization works in our area and how it has worked. I've been in law enforcement for 23 plus years at the Sheriff's Office, and of those 23 years, I can say that all 23 years has been completely about regionalization, interoperability, and collaboration. The reality of what we do in rural counties, especially in Oregon, is we have to collaborate, and we have to regionalize in a lot of things. And the deflection, diversion conversation is one of those things that we want to talk about. So just a couple of examples that we've used in our area, and I'm going to talk about Hooter and Wasco County in particularly, is we collaborate in a lot of different areas. We have a regional jail, Norcor. I'm sure some of you have heard about it. It's a 4-county jail. That regionalization of that Norcor facility has literally saved us millions of dollars throughout the last 20 22 years, 24 years in law enforcement and public safety services. So collaboration in that area has saved us a lot of money. It's made us much more efficient as law enforcement agencies, as well as increasing public safety in the area. We have other different ones, and I know everybody thinks about it differently, but from a law enforcement standpoint, we collaborate with, we have regional SWAT teams, we have regional parole and probation programs that we're working on between our two counties. We have a task force that has to do with narcotics that we regionalize, and some of these are all under the Chapter 190 stuff for the region or the Oregon Revised Statute, Chapter 190. One of the big ones that we do now is the Law Enforcement Wellness Act. We actually have, and I wrote it down here, we have 3 counties with 8 agencies that are being served. This is the mental health wellness program that we've regionalized for the Columbia Gorge. And we've got 8 agencies that are being served, and there's going to be 2 more agencies and 2 more counties that are going to be coming on board. So the reason I bring these up are great examples of not only the history of where we're at, but where we're moving. And the reality of it is for regionalization, is we can't do it by ourselves. I, as the Wasco County Sheriff, I can't do certain things that my city police does or my Oregon State Police partners do, and vice versa. There are certain things that we do as sheriffs that Oregon State Police needs our help on to move through that. So it's really, really important to talk about that. The other thing is one of the things is we've been doing it for so long, it's just second nature to us. When you build the relationships and you have the collaboration, and really from a leadership standpoint, we really focus on those things because we can't do it by ourselves. We're very, very successful, and it's second nature. And it makes us much more efficient. But I think there's 2 things that are really, really critical, especially in this topic that we're talking about today, is it makes us much more efficient, and it gives us the ability to provide high quality, better services to those individuals that we're serving, especially when it comes to diversion and deflection, because I can't do this myself, and Sheriff English can't do it himself, Sherman County can't do it themselves, so on and so forth, especially with the rural counties. So when you bring this conversation in about deflection and diversion and all those types of things, let's look at it from the base root of, we received $150,000. I knew when I got my $150,000 check when this program got started, I wasn't going to be able to do it. There's just no way I could financially do it. Representative Mannix, you actually said it yourself, it has to do with staffing as well. I just don't have the manpower to do that. However, the CJC, when we started this process, Sheriff English and I proposed the idea, hey, can we collaborate? Can we create a consortium of sorts and actually be able to compile it? And so we took our 150, made it 300,000, and now this is where we're at. And he'll elaborate a little bit on that. What I want to say, just a little caveat here, is to the people and our partners at the CJC, you guys are rock stars as far as just being able to work. I've worked with a lot of different state agencies, for those of you that are in the room, sorry. Besides the CJC. I hope that was okay. But my point is you guys are great. They were very, very accepting of the new idea of collaboration and stuff like that. So I think that's a great partnership, and I think that needs to continue and having those guidelines. The last thing I'll talk about outside of the staffing side of it is, and one of the things that is really, really important to understand under diversion and deflection is that regionalization is super, super important, because we do have a smaller population or populations. So that those individuals that need these services we're talking about today are sometimes sporadic or less. They bounce around a lot more. It's not as consistent as some of the other counties where they have a consistent program. I think of our partners at Marion County Sheriff's Office and their lead program and things like that. Sheriff English will talk about it. But why that's important as a rural agency, or agency collaboration, is because we literally do have sporadic stuff, but we still have individuals that are high risk, and we need to be able to provide those services together. So the last thing I'll say is, one of the things that we really focus on and why we think collaboration and regionalization is important, and it has to be this way, is it has to be sustainable, period. We have to have sustainable funding, sustainable staffing, all those types of things to make our programs, in particularly in rural Oregon and the regionalization concept, to be consistent and move forward. And with that, I'll turn it over to Sheriff English.
Thank you. Good morning, and co-chairs Prozansky and Krupp and members of the committee, thanks for the opportunity this morning to talk. So I'm going to talk a little bit about what the realities of a rural area are to stand up programs and kind of what things look like for us. One of the things that Sheriff McGill kind of touched on, but just to give people our perspective, between our two counties, we're over 3,000 square miles. That's what we're trying to cover in this. And so we're talking, and only about a population of about 50,000 people. So you've got a lot of area, the needs are there, but our programs have to be sustainable like he talked about, but that sustainability comes with the volume. That's the issue with us, is we oftentimes don't have the volume to sustain these programs. So that's one of the challenges. But you know, I kind of wanted to go back to the negotiations back when we were negotiating, talking with the legislature about 4002, and Co-Chair Krupp I'm sure won't soon forget, there was a lot of skepticism around this deflection discussion, and frankly, there still is in some circles. And you know, part of that's the officer buy-in that's already been discussed and things like that. But I think, you know, for us, the best thing, and I wanted to make sure that we recognize what the legislature did for us here, is number one, they didn't make counties do deflection. So we get to choose it. So right there, you're getting buy-in from the counties. And number two, there isn't a cookie cutter approach, and so it's not a prescriptive program that you have to do. And that's really helps us as a small agency, because these small communities, we have to really think outside of the box. So when this money came forward, like Sheriff McGill said, like $150,000, I'm like, what are we gonna do with this? Like that's basically the cost of one employee. How are we gonna do this? Very quickly, I mean, it was pretty obvious, and I'll be honest, if CJC hadn't officially recognized the ability to do a consortium, we were gonna kind of do it informally anyway, because we'd been discussing this. We need to combine our money, you know? And so we could, you know, report on the individual county stats, but we just needed to combine resources. And so I, you know, very nicely with hat in hand went to Commander Hepner and I said, so what do you think about running deflection? And she graciously said, yes, but we had zero groundwork. This is a ground up build for us. There's nothing that exists. So I'm Hood River County. I border Clackamas and I border Multnomah, but we might as well be an entire state away. I'm 60 minutes from downtown Portland, but we have zero access to those resources. They are night and day. And so we had nothing existing. And so we're talking about, you know, government process for our respective counties. And this stuff takes time. So I'm very thankful for the grace and patience that has come along with this, for the assistance from CJC to ensure our success, because it's very clear that CJC is there to ensure that we are successful. But, you know, we're talking about, we had to create position descriptions, get our Board of Commissioner approval, advertise, hire, do backgrounds, write policies for the program, and procedures and training, stakeholder involvement and engagement. And we knew that we had one shot at this, that we had to do it right. And so we've been slow and deliberate. We estimated right out of the gate that we probably wouldn't have anything going until the first of the year, and we're pretty much on target. We had people onboarded, our 2 deflection people onboarded December, which was what we were hoping for. But again, we've got 2 people to cover 3,000 miles. Dr. Waddell talked about it, you know, we want to do those warm handoffs. That's not reality for us right now, like not an actual physical face-to-face. So we had to set our expectations, frankly, pretty low, because we don't want to overstate what we can do. We're dealing with 5 law enforcement agencies in the two counties, and we don't want to overstate what we can do. We want to be able to deliver because we've got to have that officer buy-in. And so, we ultimately chose the LEAD model for several reasons. We were very compelled by what's going on in this county, what Marion County Sheriff's Office has been able to do. And Sheriff Hunter was offering assistance for anybody that needed it, and we've taken advantage of that. And then our district attorney, who was actually the Wasco County district attorney at the time and has now been elected in our county, he had a connection with Seattle and Seattle LEAD. Well, you would think Seattle and some rural county, there's not a lot of crossover, but that's a beauty of LEAD. We've got national technical assistance. They've come out multiple times, ongoing training. We're able to access Seattle. We're able to access Marion County. We had the Partnership for Safety and Justice out this week because we were out doing stakeholder engagement and making sure that we were getting that buy-in. But we chose LEAD because of the evidence-based aspects, the success around the nation. I talked about the technical assistance. So it also allows us to meet the needs of our community. So, it's been talked about already this morning, but we want those multiple paths into deflection. We want to be able, our issues, we have obviously a lot of, like most of the counties in the state, a lot of individuals that are houseless, that are drug addicted with mental health issues, and we're trying to reduce that frequent utilizer population. So our program isn't for first-time offenders. You've got to have multiple arrest cycles, and we're dealing with you. Officers are very familiar with these people, and we're trying to reduce the calls for service. So that's how we're selling it to our partner agency. It's like, listen, this is for you. Somebody that you're dealing with 5, 6, 7, 10 times a week, we want to get that down to maybe 3 or less. So success is going to be measured in different ways. But at the end of the day, these are the impacts that really are going to matter to our community, and we want those social referrals. We want to help our businesses that are calling because somebody's sleeping in their doorway every morning when they come in. So we really see LEAD as a fantastic model for that. And I definitely had my own skepticism when this was first pitched during the negotiations for 4002, but frankly, I'm really excited about this. I haven't been this excited about a program in a long time because we see the potential in that this is actually going to make an impact. That this is something that, Commander Hepner is in charge of our parole and probation division, and they do amazing work. But the difference there is that there's bookends on that work, right? You're sentenced, and then at the end of that sentence, if you complete probation, those services go away, and people may need those to continue. That's the beauty of this. That's the beauty of LEAD. That's the beauty of these deflection programs, is that we can continue to ensure those touch points happen. If somebody has problems 3 years down the road, they can come back to us. We'll just do a new updated assessment, and we can continue with that, so we can continue to make that impact on our community. So I'm very excited about that. I will turn it over to Commander Hepner.
Co-chairs Brzezinski and Croft, members of the Joint Committee. For the record, my name is Jamie Hepner, and I'm a commander with the Hood River County Sheriff's Office. Good morning, and thank you for this opportunity. As both sheriffs have already stated, I definitely want to highlight and thank CJC for being amazing partners. In the last 11 years, this is actually going to be the 4th grant program working with them that is in conjunction with another county. Working together, we have our impacts program, JRP, our restorative justice, and now the behavioral health deflection program, as well as we have members here in the audience today that are starting a treatment court, which is for our 7th Judicial District, which again is multiple counties together. As both sheriffs have stated, this being able to work together with Wasco County is what's going to make this program for us work. I have worked for the last 19 years in a very rural area and very resource deficient. And so, as Sheriff English stated, we don't have the volume for programs to come in and be financially stable, yet we still have the need, and so that leaves us, what do we do? And so this program, being able to work together, is going to be able to provide that and fill gaps in our services. As both sheriffs mentioned, we're receiving tremendous support from National Lead, and we actually had their support bureau here, or not here, in Hood River and Wasco County last Monday and Tuesday. And I heard from multiple people in the audience, as well as our stakeholders, how impressed they were where we are already, and that is based on the established relationships, partnerships, and trust that we have, because that's what we do. And so that was really good to hear, that we already are leaps and bounds ahead of other programs, just because we already have that established relationship. I would like to, again, talk about CJC, our joint programs, which is really the backbone and the foundation for serving our communities. And, our JRP allows us to accept STTL, short-term trans leave cases that otherwise would not be able to release to the community. Impacts. This is really interesting to me. Impacts, a grant that I wrote, supported our housing authority and allowed our seasonal warming shelter to open in Hood River County. Had we not been able to get the grant of impacts, we would not have had a seasonal shelter, warming shelter in Hood River County. And that is just very interesting to me, that a criminal justice agency is why our shelter was open. And then again, the BHD program, I mentioned numerous times when we were doing our meetings, I've been a PO my entire career, and it's a probation officer's dream that there aren't bookends. There's not a start time. There's not a stop time. Change is on a spectrum. Change takes time, and this program will allow the time to work with the individual rather than a cookie cutter approach of a judgment saying you need to get a drug and alcohol assessment, follow the recommendations of the treatment provider. Our peer navigators will be able to provide direct client services for what that individual needs, and then again, change on the spectrum work to get those needs met. Again, with the overall goal of reducing law enforcement contact and really improving the quality of lives for our clients. As the sheriff stated, that deflection isn't really under the umbrella of parole and probation, but again, in small counties, we do what makes sense. And it made sense that it fell under the umbrella of my division. And in the beginning, I was serving as the program coordinator, but in late December, we were able to onboard 2 staff, and I am no longer the coordinator, but it is still under my division. Thank you for the opportunity to speak today, and thank you.
Thank you. Short questions. We do have a question from Representative Mannix.
Thank you. It appears to me, listening to your presentation, I made some quick notes. We have, of our 36 counties, there are 16 counties which have less than 30,000 population. 4 have between 30,000 and 50,000. So 20 of our 36 counties have less than 50,000 population. And I looked at Hood River and Wasco. I see how your partnership seems to be working, because even together, you're just under 50,000 population. Do you have any comment about how we might proselytize some of our very urban colleagues about the need to understand that there may be a higher ratio of need because of the size of these low population counties? That's a little bit of a pitch question. What I'm getting at, when you've got that much territory and you have that low population, somehow the ratios that might work in Portland aren't going to work in Hood River.
Yes. No, I mean, I think that's a great point. I kind of touched on that too, and that's the challenge. That's the, trying to create a program with realistic expectations. It'd be great if we could do some of these things until we are able to build the program out. It's probably not going to be a reality to be able to have 24/7 touch points and things like that. And the metrics are different because of the volume. I'll be honest, and I was a little bit disappointed with some of the media coverage on this in the fall and winter about, drugs have been recriminalized for X amount of months, and there's been 12 successful deflection cases or whatever it was. But that's not how this is measured, and I think, success is going to be measured differently in every county. And again, when we have small counties, our call for service volume isn't as high as a metro area county, but the impacts are going to be the same. Our community is going to still have the same feeling about it, like, thanks for making a difference. It might only be 5 people, it's not 50 people. So it's got to be scalable, but I think that's the great thing about the way this is set up right now, and all the grace that we've been given to be patient, because we want to set it up correctly, but we just don't have the volume, and we didn't have the groundwork to even start from or build off of. We are right now, we're hoping to bring on 2 frontier counties that are in the same judicial district, because it will help us support the program more financially. However, we'll be able to reach out to those counties and support with the infrastructure that we're building right now by maybe adding only 1 or 2 more people, but we can support 2 more counties. But again, we're talking about a couple thousand more square miles. So challenges with that, but we see a lot of benefit, but they may only have 4 or 5 cases a year. And they don't know where to start with some of this, so.
Thank you.
I'd like to thank our panel. We are going to go to our next presentations to make sure we have enough time for that. So colleagues, please thank the participants. So our last panel is going to be on deflection participant experiences. We have 5 individuals that will be part of the panel. Ben Spence, Helen Rice, Hank Krapster, Tony Vizina, and Taylor Stebbins.
Good morning.
Good morning.
Co-chairs Przansky and Krupp, members of the committee. For the record, my name is Hank Krapser, and I'm here representing the Marion County Sheriff's Office Law Enforcement Assisted Diversion Program. I am also a person in recovery from drug addiction. This year I celebrated 12 years clean and sober. Prior to getting clean, I spent the previous 30 years strung out on drugs and in and out of jails and prisons. For me, that turning point was finding out I was going to be a father. So I got clean and I did all the things that I needed to do to raise my son. I picked him up from the hospital in June of 2013, and it's been me and him ever since. In the beginning, as I was raising a newborn, I made a promise to make a living amends to this community by using my past to help folks like me. And so that's what I did. I put myself in school to become a licensed counselor, and part of that process was my internship. And when I was doing that, I was able to do that at Marion County Health and Human Services, Addiction Treatment Services. And that's where I found out about this program. There was a new program that Marion County had just started called the Law Enforcement Assisted Diversion Program. And I saw the potential of people like me working with law enforcement to help people like me. And at its core, LEAD is a pre-arrest diversion program designed to divert low-level offenders away from the criminal justice system and connect them with community-based resources, services, and treatment. We connect those folks with navigators like myself and like Helen, because it's important for our people that are out there struggling to get help from those of us who have firsthand experience with addiction and recovery. We know what it's like to be where they're at because we've been there too. That creates a bond, a connection, a trust that can't be got in other places. And seeing someone like myself and like Helen and the other navigators that have overcome addiction gives them a sense that recovery is possible, that they can do this too. We get to share with them real-life coping mechanisms and strategies that kept us clean and that helped us rebuild our lives. We get to navigate with them their own paths to recovery. We share, our guidance is practical and relatable because it's based on our own experience and not rather from theory. And so none of this would be possible if not for the partnership with law enforcement. We now partner with 11 different law enforcement agencies, every law enforcement agency inside Marion County. The navigators keep 24-hour on-call phones. We can take calls from any one of those law enforcement partners at any time of the day. We get a call at 2 in the morning and we can respond to the scene where they are and start getting that person the help that they need. I have brought a couple of, I've been doing this for 6 years and I have brought a couple of success outcomes with me to read to you. I've been able to be part of many, many of them. I've been doing this 6 years. I have multiple folks with many years in recovery that have rebuilt their lives, that have, I believe it's 20-some folks now that have regained custody of their children, and it's an honor to be able to be part of this. But like I said, man, if not for the compassionate accountability of our law enforcement partners, none of this would be possible. You see, it would be real easy for them to have contact with somebody and issue them a citation and send them on their way, or take them to jail and let the criminal justice system take over. But they don't do that. They care enough about them to get them the help they need. So they call one of us and we respond to the scene and get started with those folks. I'm gonna read 2 of them for you here today. The first one says, it took a law enforcement intervention to shake me awake long enough to realize just how far I had fallen. Because as long as I was on fentanyl, I wasn't making decisions, I was just surviving, or barely even that. Getting introduced to Hank was life-changing. He wasn't just another person preaching recovery from a script, he had lived it. He knew exactly where I came from because he had been there too, and that meant everything to me. For the first time, I wasn't just hearing treatment talk from someone who read it in a book. I was hearing it from someone who had walked through the same fire and made it out the other side. That made all the difference to me. He game planned this whole path and laid it out to me and walked with me through all of it. Today I've been clean for 3 years. I have the trust of my family back. Today I've completed my parole and have paid my restitution, and I'm a contributing member of society. If not for LEAD, I know 100% I would have lost my life to fentanyl. This one says, Hank and I go way back. I knew him from the drug world before he got clean. But when he came to see me about LEAD, he didn't even recognize me. I was at my lowest, sitting on the curb with my head in my hands, slowly killing myself with drugs. Joining LEAD wasn't a smooth path. I stumbled, I relapsed, but they never gave up on me. At one point I was in jail, and when Hank came to my court appearance, he did something I would have never expected. He asked the judge not to release me. Not because I was a danger to the community, but because I was a danger to myself. That accountability saved my life. Being held until I was healthy enough to think clearly gave me the strength to start making better choices. By the time I was released, I was ready. Hank stood by me traveling to multiple counties, advocating for me in court, showing them that I was finally doing the work. Having someone like Hank, who had once been in my shoes, made all the difference. He literally pulled me out of hell. Now I've been clean for 5.5 years. I've regained custody of my daughter, and I have a career. Best of all, I get to help other women in recovery who are facing the same struggles I once did. LEAD saved my life, and now I get to pay it forward. These are just two of the many amazing outcomes that I've been blessed to be a part of, and there are so many more. I just want to say thank you for having us here to be able to speak about our program, and thank you to all of our law enforcement partners, because without those phone calls, none of this would be possible. Thank you.
Co-chairs Przanski and Croft, members of the Joint Committee. For the record, my name is Helen Rice, and I am also a lead navigator for the Marion County Sheriff's Department. In the past, I have struggled with drug addiction and criminal activity. However, today I have 5.5 years clean, and I'm currently holding a CRM2. I am actually in the process of getting my record expunged, and I am pursuing my bachelor's degree in criminal justice. Let's see. I wrote my stuff down because I hate public speaking. In my job today, I've been at my job today for 2.5 years, and today I get to help people climb out of the same hole I was in. I was able to ask one of my clients, what does the LEAD program mean to you, and be completely honest. And the response I got was, it's helped me to see that I'm not alone and I have support. I would suggest the LEAD program to anyone struggling to get their life back on track, as it has helped me see that I can be sober and live a happy life. And no matter how much I think I don't amount to anything, I have a cool navigator that always reminds me I can do anything. I can remember the mentor that I had when I was getting clean, and the counselor that I had when I was getting clean, and the impact that they made on me today. And I just want to make the same impact, and being able to meet people where they're at, whether it be, in the streets, in sober living, in jail, and let them know that I've been in the same position that they've been in and everything that I have now, and that even today, I still have trials and tribulations that I have to work through. It means a lot to them. And I think that without this program, it wouldn't be possible for us to partner with law enforcement and get people the help that they really need. And they have to want it. They have to want help. We can give them all the resources and suggest everything that we can to help them get on the right track, but unless they truly want it, it's not going to be beneficial to them. So at least we're here to provide it for them and continue providing them with encouragement and services as long as they need it. Thank you.
Co-chairs Przanski and Crop, members of the Joint Committee. For the record, my name is Ben Spence. I'm the Community Justice Programs Manager for the Addictions Recovery Center in Medford. I'm a person in long-term recovery. I also have personal experience with the criminal justice system. On March 11th, I'll have 9 years in recovery. I want to share a story that highlights the power of deflection and how it provides a real alternative to the cycle of incarceration and substance use. Recently, an individual was extradited to Jackson County on a warrant stemming from a 2-year-old property crime. After being lodged, he was quickly released with nowhere to go. With no resources or support, he was picked up again, this time for trespassing. During his police encounter, he admitted to substance use and was offered the deflection program. A warm handoff was provided by the Medford Police Livability Team. He was assessed, and during the conversation, they told the officer, sorry about that. A warm handoff was provided by the Medford Police Livability Team that same day, a Friday. He was assessed, and during the conversation, he told his deflection peer that he wasn't sure he would stay. He was considering hitchhiking back to Roseburg. Uncertain whether this opportunity could really help him, we encouraged him to stay and give deflection a chance and see how it could connect him to resources and a supportive recovery community. By the time he left the engagement center that day, he had not only completed an assessment and a treatment plan, but also had a full belly, a referral for temporary housing, fresh, clean clothes, and a sleeping bag. By Monday morning, we were unable to reach him to let him know he had been accepted into an access shelter with an individual room. Hoping to find him, his deflection peer drove through Medford on the off chance that he would run into him. He found him at a place where the client said, "I'm not usually there." When his peer took him to his new room, his eyes lit up, and he said, "The cop said you guys would help me. I didn't believe him. I can't believe he meant it." Since then, he has engaged in outpatient treatment 3 times a week. At first, he had no clear goals, but over time, he started setting small but significant ones. Doing his laundry weekly, showering and shaving daily, seeing a doctor, and focusing on his health. Now he has made the decision to pursue residential treatment. He's currently on a wait list for a treatment bed, and every time we see him, he expresses his gratitude, not only for the effort we made to help him, but also for the officer who made the connection. This is what deflection does. It provides immediate intervention and support for people who would otherwise be cycling through the criminal justice system with no real path forward. Instead of sitting in jail or being left on the streets, this client is on a path towards stability and recovery. With just one more treatment engagement, he will successfully complete deflection. This is why programs like this matter. They don't just reduce recidivism, they restore dignity, humanity, and hope, creating opportunities for lasting change. Thank you.
Dear co-chairs Croft and Przanski and members of the Joint Commission, my name is Tony Vesna. I'm the Executive Director of 4D Recovery. They told me I had a little bit longer to talk, and so I figured I'd riff for just a second on the Criminal Justice Commission and say that I was a little concerned about this setup with y'all sitting over there and me up here, but it's actually a nice change from going to the Capitol where you all are much elevated above us. I feel like I have a little authority in this situation, so maybe we could switch that up at the State Building. Let me just, okay, this feels a little better. I'm really happy to be here. Give a shout out to everybody here who's doing the work on the ground and who's in recovery. I'm also in recovery. I'm the senior member. I just found out on this panel, and I'll have 13 years in July, and I'm really proud of that. I just want to say that, my story isn't everybody's story, but for me, it was a combination of police intervention, diversion, treatment services, and then, of course, the recovery community that is responsible for saving my life, and I'm very grateful for that. 4D Recovery provides a variety of services that help adolescents and young adults overcome substance use disorder, includes peer support, treatment, recovery, housing. And we currently have deflection programming in Washington, Clackamas, and Multnomah counties, all of which we are very proud of, and I'm really proud of my staff. Deflection provide a unique opportunity, in my opinion, to unify public safety and healthcare providers after a time when law enforcement, I feel, was taking a lot of public criticism. I think that deflection blends responsibilities between the two systems wonderfully. In our case, allowing peers, people in recovery, the opportunity to encourage other people to seek recovery as an alternative to entering the legal system. This program, at least in my little part of the world, is changing the culture between healthcare providers and public safety teams. There's been a shift in how we thinking about each other, and it's been really great to watch that happen. And to some degree, I think there's been sort of a healing between the two sectors, especially for the public safety folks. At 4D, we have peers located in courtrooms, those working with public safety to intervene at the point of contact, and other assertive outreach and engagement teams working with a variety of people in coordination with public safety teams. Since November, our deflection and assertive outreach programs have referred 79 people to deflection, pitched recovery to individuals an additional 2,344 times. That's not individual people, that's just sort of engagements with people. We've been able to provide approximately 388 referrals to a variety of services, with roughly 51% of those referrals being treatment. I have received general positive feedback from staff, DAs, county administrators, cops regarding our approaches and collaboration. Pretty much everyone has been excited for deflection, besides the media, it seems. One of the most effective and exciting deflection programs 4D has is in East Multnomah County, where 4D recently opened its addiction treatment, housing, and recovery support service continuum. Our deflection teams are just literally out all day long pitching recovery to people who use drugs. You know, at 4D, our goal is to intervene and motivate people to go to treatment, and we work with local law enforcement to identify those individuals. Our treatment center, I got Dr. Crapser in here, that's Nick's brother. Dr. Crapser's in the back. He's got a bald head but no beard with 4 stars on his chest. They look very similar. He's been great. He came on and helped us open up our outpatient treatment center in East County Gresham, and we've been doing same-day assessments, which has been really great for us because when the deflection teams go out, however they interact with somebody, and we can talk somebody and pitch recovery to them, we can go get them assessed and referred the same day, and that seems to have been working a lot. A major criticism has been around success rates. I'd like to put this into context, add a few more points, and then my coworker here, Taylor, is going to talk about day-to-day stuff they're doing. First and foremost, deflection interventions are not going to work 100% of the time for 100% of the people. It's just not. That is, you know, oppositional to the science of addiction. It takes multiple times to quit anything. Try to tell people, think about how many times you go and try to quit eating Popeye's chicken and eat a salad and go to the gym. Now, imagine trying to quit something that is the most addictive substance on earth. It's very, very difficult. So to think it's going to work 100% of the time is illogical. But we are going to be able to get some of the people, and that's going to free up public safety time. It's going to reduce crime. It's going to get people back into the workforce, being good, upstanding citizens of the community. Along with the success rates, deflection seems to be isolated in looking at House Bill 4002, which has this broader diversion sort of framework. And so I don't think deflection should be looked at as a silver bullet catch-all. Deflection interventions outside of direct police interventions, as defined by the amazing presentations today, are a great way to reduce the need for incarceration. And personally, I'm worried about 4D's ability to continue doing the wonderful services that we're doing because the Measure 110 Oversight and Accountability Council voted to disallow Measure 110 funds to be used for deflection. And part of our programs leverage that funding. And so to the degree that our elected officials can either provide counties with a little more funding to keep these kind of programs going or do something, I think it is critical to the long-term effectiveness between the two different systems. Deflection and diversion is limited by capacity and treatment. Even if we refer people and they want to go to treatment, and if it's not there, it's not going to be as effective. Now, you guys have put a lot of money into treatment over the years. I really, really appreciate that, so I do not want to diminish that. We've made great strides. We have amazing programs going on, but let's not quit what we started. Let's finish it. And then lastly, I think it'd be beneficial, extremely beneficial, to open up deflection eligibility to include other low-level crimes often done in conjunction with drug use. When I was out there, I talked about it yesterday, I was stealing Tide and chromies and stuff off cars. I was doing other stuff. It was mostly driven by my addiction, and I think we could get a lot of people into treatment if we incentivize that. So, you know, to our legislators, thank you so much for your continued service in solving these extremely complicated, often polarizing problems on behalf of Oregonians.
All right. Co-chairs Przonski and Kropp, members of the Joint Committee. For the record, my name is Taylor Stebbins, and I am the Multco Deflection Outreach Supervisor for the Fourth Dimension Recovery Center. I am also a person in recovery. I'm coming up on 4 years on the 20th of this month. Thank you. And I'd like to share some success my team and I have witnessed through our deflection program, as well as provide insight into the challenges we encounter on a daily basis. One particular success story stands out to me. An individual who was referred to us received a variety of resource options during our initial contact. When my team and I followed up a couple of weeks later, we were pleased to learn that this individual had made significant strides in their life. They had taken the critical step of leaving the streets and securing a place in a safe rest village. This alone would have marked a successful outcome for their deflection care plan. However, they did not stop there. The individual continued to pursue a better life and enrolled themselves into a medically assisted treatment, MAT, and outpatient program, which they were connected to through deflection. Several months later, we encountered this individual again and heard their story. They expressed sincere gratitude to our team and shared that they were celebrating 30 days of sobriety. This is just one example of the positive impact deflection has had on individuals in our community, and it highlights the potential of this program to make a meaningful difference. Every day, my team and I work directly with individuals in the houseless community who are struggling with substance use disorder before law enforcement becomes involved. We dedicate considerable time to building trust and rapport with these individuals, offering support and encouragement as they take the necessary steps to improve their lives. Once an individual is ready for treatment, we at 4D facilitate immediate access by escorting them to our treatment facility for a same-day assessment, which is crucial given the often lengthy wait lists at other facilities. Following the assessment, we can connect them to detox and treatment services either through 4D or our community partners. To date, we have successfully enrolled and engaged 7 individuals in active treatment programs, which is a testament to the effectiveness of our work. I'd also like to mention that we have recently developed a partnership with Gresham Police Department. We're working with them pretty regularly, and I'm very excited to see the outcomes of this. Thank you all for allowing me the opportunity to share these successes with you. Your continued support helps us make a lasting difference in the lives of those we serve.
Colleagues, are there any questions? Well, I want to thank the panel. Because of the timing, we'll be taking any public questions at this point. I would suggest that if you have questions for the presenters, please find them after this presentation. And we want to thank you for, 1, being here today, 2, being willing to share your lived experiences, and for all the work that you're doing today and paying it forward. Thank you.
Just echo what Senator Przansky had to say. I will also echo what one of the other presenters talked about, in an appreciation for the CJC for putting this together, and just an appreciation for the Criminal Justice Commission in general. I am also not allowed to pick a favorite state agency, but that agency has always been incredibly responsive and incredibly the sort of customer service attitude about how the state can partner with local communities, and I think that's attributed to Ken and the team that he has put together. So I want to say thank you to that organization. And I want to say thank you for everybody who is here today and communities who are beginning deflection programs. I've had a chance in this session to sort of reflect on last session, and when we started these discussions last session, sort of my guiding light was, I thought when I was a prosecutor in 2019, we could do better than what we were doing in that place. And I also thought we could do better than what was happening under Measure 110. I would say there was a number of positives from Measure 110, right? We've increased funding for folks like we saw on the stage today, peers who help people in their own journey for recovery. But we lacked tools for law enforcement to intervene. I've appreciated getting to know the different counties and the programs that they have, and I want to echo one of the things that I heard Tony say is what has become evident to me in meeting those counties is this increased relationship between law enforcement and the public health and behavioral health system. Like, if we're going to solve this problem and we're going to continue to help people, it's going to take a level of connection and collaboration between those two systems. And what I appreciate about the deflection program is the sort of immediate accountability that it provides and the immediate connection it provides. When I was a prosecutor doing a sentencing hearing, we did sentencing hearings always the same way. I would start out, the judge would ask me to sort of give a recitation of the facts. And I'd almost always start out by saying, 6 months ago, judge, or 9 months ago, or 12 months ago, this thing happened. And then there would be a sort of a consequence or a sentence given to that. I will tell you, I got a chance to do a ride-along with Helen last year, and I got a chance to meet a couple of the folks that she worked with. And what impressed me was the relationship and the trust that they had in Helen, and how Helen had reached out to them, and how Helen had helped them. And that relationship began from the first contact they had with law enforcement. There was no citation, see you in court in 30 days, or come back for your sentencing hearing in 2 months or 6 months. It started from that moment. And I could tell Helen put her sort of heart and soul into that work, and I could also tell that the folks that she was helping appreciated her and valued her. And those folks didn't have a lot of other people in their life like standing next to them and fighting for them. So I learned a lot on that day, and just watching the work that Helen does sort of reinforced to me the potential of these types of programs throughout our state.
Any other closing comments?
If I may, I appreciate what the co-chairs have had to say, and also the arrangements that have been made for this gathering with the Criminal Justice Commission, and the incorporation of their scheduling opportunity with us, and the opportunity to have a wide range of folks here from people who are engaged in the system. And we've made some notes about what we've heard, and I'm making some notes that I'll remember, such as we need to make sure that Measure 110 funds are available for deflection, because deflection is part of the treatment program. And maybe we should add some more crimes to the eligibility standards for deflection. There's other notes that I've made here, but this is helpful to us to hear directly from folks that are involved in this process, and I know we'll be hearing more from folks. And again, I thank the co-chairs for arranging this. Thank you.
I'm probably the only one up here that's not a lawyer. I'm a mom. And my district is District 31, so it's a very rural area. And so what I learned here is taking notes of how to connect those large areas that have already got this kind of down and bringing it back and helping my community. Thank you for this opportunity to hear and to learn, and I took copious notes, so thank you.
So in closing, as you've heard from other members, it's a multiple parts that we have to work on, and you in the audience are part of that. I want to thank you for being here. I know what CJC has done in the past as to bringing the people together. This is an opportunity for us as a state to work together across the state to actually help our friends and our neighbors to actually find a route for them to actually be able to be successful, return their own life to themselves, their families, and their communities. So thank you very much for being part of the process, and on your travels home, be safe.
I'd like to thank the members of the Joint Committee who were able to be here with us today. I know it's really tough to be off schedule, and so it's been amazing that you've allowed us to present this information to you, and it's really heartwarming to hear the takeaways that you all have taken from this. And so thank you very much. Another round of applause for our legislators and staff.
We do have one formality because we are recording this. This is an informational hearing of the legislature. We adjourn our meeting at this time. Thank you.